Expressing breast milk. Breastfeeding is natural, but it is also a skill that takes time and practice for both you and baby to learn. In the early days, the more you hand express, the more milk you will make later on. This is especially important if your baby is having a difficult time latching or feeding away from the breast. As your baby gets older, you may want to express your milk and leave it with a caregiver while you go out. This module will walk you through some of the basics around expressing your breast milk, ways to feed the milk to your infant, and how to store your expressed breast milk. You may need to express milk for one of the following reasons. If your baby is very sleepy and can't latch, if your breasts are very full, to help clear a plugged duct, to help increase your milk production, if you and your baby are separated. We make every effort to keep mums and babies together skin to skin as long as it is safe to do so. Our goal is for mothers and babies to stay together. If you or your baby are unwell and need specialized care away from each other, it is very important for you to work at building and protecting your milk supply while you are separated from baby. You can hand express or pump every 2 to 3 hours, day and night, just as frequently as baby would be feeding if they were with you. You have to move the milk to make more milk. If your baby is taking feeds away from the breast, it is important to hand express or pump your breasts 8 to 10 times a day. The time it takes expressing your milk varies depending on your body's needs and your goals. Contact a healthcare professional for support and guidance. There are pamphlets available with more information. You can search the internet for Fraser Health Patient Education, and here you can search for the following pamphlets: using a breast pump or increasing your milk supply. There are 3 main ways to express milk: using hand expression, a hand pump, or an electric pump. Supplementing is giving your baby your own express milk, donated human milk, or baby formula in addition to breastfeeding. When giving your baby a supplemental feeding, your own milk, freshly hand-expressed or pumped, is best. The second choice would be your own milk previously frozen that is thawed just before using. Third choice would be pasteurized donor milk from the milk bank at BC Women's. And fourth choice is store-bought infant formula that is cow's milk based. Some families may need to supplement their breastfed baby for medical reasons, while others may choose to supplement for personal reasons, keeping in mind that giving the baby only breast milk is the best choice for ongoing health. It's important to remember that each time you give extra milk, protect your supply by hand expressing or pumping. Now, let's move on to hand expression. You don't need a lot of equipment to do hand expression. This is why it is an important tool for all breastfeeding mothers to learn. Before you start to hand express or pump, make sure to wash your hands well with soap and water. If you are expressing for a baby in the NICU, try expressing your milk within 1 hour of birth. If this is not possible, start expressing within 6 hours of your baby's birth. While you're in hospital, the nurses will give you a clean container to express your milk into. It may look something similar to one of these containers. If you're at home, prepare a clean spoon, cup, or bowl to catch the milk in. Prepare your breasts by wrapping them in a warm, damp cloth or towel. Warmth helps the milk to flow better. Massage gently over the top of a damp towel, working from all areas of the breast towards the nipple. We will now watch a video from the UNICEF UK Baby Friendly Initiative on how to hand express. Some find it helpful to practice hand expression on their breasts while they watch the video.
The UNICEF UK Baby Friendly Initiative recommends that all mothers are shown how to hand express. This is a useful skill which can be used in the following situations: expressing small lots of colostrum to tempt a sleepy baby in the early stages of breastfeeding, when breasts are full, making it hard for babies to attach, to help clear a blocked duct, or if you are separated from your baby, for example, if your baby is on the neonatal unit.
So when you're hand expressing, start off by doing anything that relaxes you. So having a cuddle with your little one, skin to skin, bit of massage, anything that helps you relax. So sometimes it could be kneading around the breast, sometimes it's stroking, whatever feels right, whatever feels comfortable to you.
If expressing for a premature baby, massage is important to ensure a good milk letdown. However, if just expressing to soften your breast, just a small amount of massage may suffice.
Once you've done that for some time, if you make a C shape with your hand, with your thumb and finger, gently feel back from the nipple, about 2 to 3 centimetres. Hold it for a couple of seconds and then release. And then just compress, hold and release. Now in the early days with colostrum, this won't come straight away, it can take some time. So just keep working that one area. It will appear as little beads. As the milk comes in, you'll see it will flow much more easily. Sometimes you might need to move forward a little bit, sometimes you might need to move back a little bit. The main thing is working that one area until it fully subsides. And then what you can do is rotate round the breast and work on the next area, compressing, holding and releasing. So the key thing as you're doing there, you've kept your fingers right in the right place, that's perfect. And the key thing is you're doing that compression right where your thumb and finger are, and you're making sure you're not sliding, and that's really important. When you slide along the skin, it's not as effective and it can also cause a bit of trauma to your skin, so working in that one area, keeping that thumb and finger opposite each other is just perfect.
There are 2 main types of pumps, a manual pump, sometimes called a hand pump, and a single or double electric pump. A manual pump is the cheaper choice and is fine to use if you're only pumping 1 or 2 times a day. If you're using your pump more often, you may want to pay the extra money for a single or double electric pump. In the communities, you can rent a hospital-grade double electric pump from your local pharmacy. You will need to buy the tubing and plastic bottles in a kit. Call your local pharmacy about rental prices. If you have questions about choosing the best pump for you, call 811 or your local health unit. As with hand expression, it is important to wash your hands with soap before handling equipment or pumping. Follow the directions that came with your pump to put all the pieces together and to operate it correctly. Start with suction on the lowest setting, or if you are using a hand pump, squeeze gently to begin. Once you see milk flowing, you may increase the suction, being careful not to cause pain. Without breaking the suction, you can use your hand to massage and compress your breast while pumping to get the most milk. Pump until your milk stops dripping and then switch sides, unless you are pumping both sides together. Finish your pumping session with hand expression to get even more milk. You can find this information in Baby's Best Chance on page 106. Write the date and time that you pumped the milk on a label or directly on the milk storage bag. To clean your pump, check the manufacturer's instructions for specific cleaning directions. Often the suction tubing does not need to be washed as milk does not go through it. Take the pump apart after every time you use it. Wash all the pump parts that come in contact with milk in warm, soapy water. Rinse well and air dry upside down on a clean towel or drying rack. If your baby is preterm or ill, boil the pump parts that need cleaning for 10 minutes daily in a big pot of water. Make sure all parts are covered by the water. Now that you have expressed some of your milk from your breast, you are ready to feed it to your baby. To help baby learn breastfeeding well, it is helpful to not use a bottle. This video from Healthy Families BC will show you how you can use a cup or other methods to feed your baby.
Cup feeding and other feeding methods. Sometimes breastfed babies need additional milk. The first choice is mother's own expressed milk. If this is not available, the next best choice is pasteurized donor milk. Ask about the availability of donor milk in your hospital or community. If pasteurized donor milk is not available, formula can be provided. In the early days, when only a small amount of colostrum, your first milk, is produced, a spoon usually works well to feed your baby. Hold your baby upright, supporting her head, and place the spoon against her lips to gently feed. Once you are producing a larger amount of milk, you can usually feed your baby additional milk using a small cup. Wrap your baby's arms lightly with a blanket to keep her from knocking the cup. Hold your baby upright in a sitting position, supporting her head, and let your baby control how much milk to take in at a time. After cup feeding, unwrap your baby. If the baby is able to latch onto the breast, the additional milk can be given at the same time as breastfeeding. This can be done by placing a small feeding tube into your baby's mouth alongside the breast so that your baby receives the extra milk. Ask for assistance from a knowledgeable healthcare provider. For a breastfed baby, a bottle can be used, but you are encouraged to try other methods first. Using a bottle before breastfeeding is well established can make breastfeeding more difficult.
When you have expressed milk that you want to store and use later, you need to know how to keep the milk safely until you feed it to your baby. You will find this information in the 2019 version of Baby's Best Chance and the 2020 version of Breastfeeding Your Early Preterm Baby. This chart is the guide for storing milk for healthy full-term babies. When fresh breast milk is kept at room temperature, it is safe for up to 6 hours, as compared with previously frozen breast milk that can be stored at room temperature for up to 4 hours. In your fridge, fresh milk is safe up to 5 days and previously frozen and thawed milk up to 24 hours. Your fridge freezer that has a separate door can be used to keep milk frozen up to 6 months, and a deep freeze can be used for up to 12 months. When it is time to warm the milk again for baby to drink, it is a good idea to thaw frozen milk in the fridge. It can thaw for up to 24 hours in the fridge before feeding it to your baby. If you need to warm it right away, run the container of milk under warm tap water or sit it in a bowl of warm water. Microwaving milk is never a good idea. It kills the healthy cells and nutrients in breast milk and has the risk of uneven heating, which may lead to burns in your baby's mouth. If your baby is born early, called preterm, safe storage times are shorter. There is a very helpful booklet called Breastfeeding Your Early Preterm Baby that you will receive from your healthcare provider, or you can download it from the Perinatal Services BC website. This booklet has detailed information on milk storage and many other breastfeeding topics. Thank you for watching this module. For many parents, trying a new skill like expressing milk can bring up many questions. You can speak with your doctor, call 811, or call a public health nurse at your local health unit. If you have any questions, be sure to talk to your doctor, midwife, nurse practitioner, or call 811, which is available 24 hours a day, 7 days a week, or call your public health nurse for support. Be sure to check out these good sources of information on expressing breast milk. In the next module, we will learn more about what you can expect in the first few days with your baby. Express